just like if someone had a serious case of the flu and was suffering or had broken a leg, and you would encourage them to seek assistance. So I think in a similar fashion, depression is an illness, and so encouraging your friend to get help or to get assistance. Sometimes there are stigma and misconceptions concerned about seeking mental health counseling. So, for example, here at the university, counseling is free. You don't have to have insurance. It's confidential, which essentially means we don't say anything to anyone without the permission of the student. There are some exceptions, but they're relatively rare, and they're usually life-threatening circumstances, or we're mandated reporters for abuse of children, senior citizen, and disabled. So I think combating the stigma, also what we call the installation of hope. So many people and many students who are suffering from depression can be helped and have been helped. And so there is a way to sort of get better. Well, students sometimes will have a lot of difficulty performing well academically, because if you're depressed, it's hard to concentrate. Students often report reading the same thing over and over again, but not being able to retain it. Your energy level is very low. It's hard to function. Often students have some sleep disruptions, so they can't sleep at all because they're so worried, or they can't get out of bed because they're feeling so down. So with all those factors, it makes it very difficult to function well academically. Also, students frequently will isolate themselves, and so it makes it more difficult for them to obtain emotional support. And another real risk factor is frequently when students are depressed, they often will have thoughts of suicide. Now, it doesn't mean that they will come up with a plan, but it is a risk factor. Suicide is the second leading cause of death for college students. So I think those are some telling factors that would indicate that it would really be important for a student who feels they are depressed to get some assistance. Well, on the one hand, I think depression is sort of like the common cold. And so from time to time, not only do we get down, feel blue, but those feelings are going to linger, and they're going to negatively impact the way we function. At the same time, to be alert to those signs, to, I think, maintain healthy relationships. As much as possible, it's really not a good idea to drink or use marijuana or other drugs to sort of self-medicate oneself. Alcohol is actually a central nervous system depressant, so you can If you're feeling down, it will help you feel more down. The other thing I think I haven't mentioned, but let me just say a bit about it here, is that often medication can be very helpful. It's not helpful for everyone, but for many students who are feeling depressed and or anxious, medication can help with alleviate all those sorts of symptoms that I was describing earlier. And together with talk therapy, people can learn ways of coping and new skills that will help them to deal with life's inevitable struggles.